Hello everybody, my name is Sternberg. I'm one of the plastic surgeons in Ponte Vedra Plastic Surgery. Today I was going to talk to you about how we do our breast consultations, the experience, and what to expect. I think the most common thing that patients experience when they come for a breast consultation is they're very nervous about it, and it's usually based on the size. They don't want to be too big, they don't want to be too small, they want to be just right, kind of the Goldilocks experience. And so I think the important thing is first relieving you of that worry that we're going to talk you through the process, and we're going to get the process, and we're going to get the sizing exactly right. And how do we do that? We do multiple steps. First, just in conversing with the patient, I think all of us as surgeons, we get a very good understanding of what the patient's goals are. Some patients specifically desire a very augmented, full, and more, fake-looking result, whereas other patients are completely opposite. They want a very natural, a more athletic, shapely breast. So that's a very different patient, and they're approached very differently. So when we first see the patient, after talking to them and getting an idea, we tell them how the procedure works. The safety is paramount in our office, so using a high level of anesthetic care, you're asleep the whole procedure. We use it at our board certified and state licensed surgery center, so safety is out of the question. That's not even an issue, that's top of the line. Next, we discuss with a patient their goals and desires. That's when we discuss and we look at some pictures and say, do you want a very fake, augmented, round looking top? Do you want a more naturally shaped, more teardrop, natural breast? What are your goals? And then we'll do some measurements, of course, at that point. And that's when we'll usually start with our medical assistants and technologists will help with the patient trying some implant sizers in their bras. So this is for a standard breast augmentation. We'll try some inserts in a bra that we give you to kind of just see what you would look like in the mirror, looking yourself naturally to see what those sizes are, because breast implant volumes translate differently on every patient. A 300cc implant is going to look different on a 6 foot tall, lady versus a 5'5" lady. So we want you to see what those implants look like volume wise, and that'll kind of translate to whatever you want to look like, what your desired look is. So we'll try those first. Then what we do is a 3-dimensional imaging software that I think most of us enjoy doing during the consultation, and the patients really love it because they get to see themselves in real life in real time. So this has been really helpful as a tool for us over the past 5 years. We use it, I would say, almost with every consultation for a primary breast augmentation. Sometimes not so much for revision surgeries or for breast lifts in combination with implants, but certainly for primary breast augmentations, it's a very common tool we use. And that's called Chrysalix. The Chrysalix model that we use is this, it's on a tablet. We take a picture of the patient's body, and then we can show the patient's before, and then we can show the patient after with different sizes. We can simulate the sizes by going up on the, or down on the simulation. So we can go up, and then kind of show the patient, from that standpoint, what they would look like now, and then transitioning to that 300, 345, 350, whatever, translation. So just being able to see that and seeing the difference an implant would make in real time, real life. Then we also give the patients a copy of that to take, to be able to access from home. That way they can show their partner, their family, their husband or whoever, these images, and they can sit down together and look at that and be like, yes, I really like that. It's exactly the look I was going for. It's more teardrop, it's not as round. That's it. And some patients will come back and say, can you try one down from that or one up from that? So this Chrysalix 3D imaging has been a very, very powerful tool for us to be able to show ladies what you would look like before and after, and really get a feel for what the implants look like. And this has been probably the most accurate sizing tool we have. So as an adjunct to putting implants in a bra, the traditional most plastic surgery offices where you just look at yourself in the mirror, we use this as an adjunct to that, just a step above in the consultation process, and I think that really makes patients feel comfortable with the size they chose. So now you've chosen your implant size, we finished the consultation. Usually patients are very excited at this point. They're ready to move ahead, and that's when we'll have you see our patient concierges and patient care coordinators, and they'll go through the pricing and information and kind of look at some dates that are available. I think by that point, patients are super excited and ready to move ahead. About 2 weeks before surgery, you'll see me and my nurse for the actual preoperative visit, which we answer any further questions, kind of work with the sizing one more time, get everything ready to go for surgery. And on the day of surgery, you'll see me again. We draw on the patient, specifically where we want the incisions, all our measurements, and then you'll meet the anesthesiologist the day of surgery and then surgery. A quick intro into the consultation process is Ponte Vedra Plastic Surgery. The main goal is to make patients feel comfortable and very relaxed in the decision they've made. I want 10 out of 10 patients coming back and saying this is exactly what I want it to look like. I'm so happy the way it turned out. I think I've seen plenty of other patients at other practices that come back and they're like, I'm way too big, or I'm not, this is not what I was looking for at all. And I think we can take a lot of that uncertainty out with these different modalities. The typical recovery for breast augmentation surgery is about a week. Most patients require pain medication and some muscle relaxers for the first 2 to 3 days, and that's very typical. After 3 days, most patients are pretty much on non-steroidal anti-inflammatories like Advil or aspirin or Tylenol. By the end of the week, there's still some soreness, but no one's on medication. That people are returning to normal life, light activity, which would be driving, taking the kids to school, that kind of stuff. By the end of the second week, back to normal, more normal activities, exercise, light activity, light jogging, that kind of stuff. So very quick return to activities. I would tell patients, take about before planning any major events or trips or, going away, I would plan on about a month before that. And then by 6 weeks, you're traveling to vacations and skiing and whatever you want to do. So a very easy recovery period. The first 48 hours is probably the most intense, and patients get over it really quickly. For patients planning on doing breast surgery in general, whether it's breast augmentation, breast lift, or any type of breast revisionary surgery, and they're planning on doing that before a big event, a reunion, a wedding, some major event like that, I like ideally 3 to 6 months. Now that doesn't always happen. Some patients are really under more of a time crunch than that, but for sure no less than 6 weeks, because they have to have some time for the skin to accommodate the new implants, for there to be some stretching and some healing to go on. Thank you for listening and watching this video, and for any other questions you can tune in and look up. All of our procedures are available at pvps.com.